Hi, my name is Mark Knights. I work in a hospital in Ysbyty Gwynedd in Bangor as a consultant anaesthetist, and I work as a flying medic on board the Wales Air Ambulance charity helicopters. Essentially, we are a mobile accident and emergency now. The equipment we carry with us are compact versions of the equipment that you would expect to find in any hospital accident emergency. By taking the accident emergency to the patient, we are reducing the time it takes for them to receive the vital early care that they need. We're also able to diagnose the underlying problems that a patient has and take them directly to the hospital that can best provide the specialist care that they need. This avoids potential delay and the need to transfer a patient again from one hospital to another. So for occasions when we're unable to fly due to poor weather conditions or sometimes due to specific patient requirements, we also have a fleet of rapid response vehicles, and we can have exactly the same equipment on board the vehicles as we do on board the helicopters. So we can still get to the patient even if we've got bad weather. Okay, so this little machine here is actually, it's called the Epoch. It's for testing blood. So we can test people's blood for their blood gases, how much oxygen or carbon dioxide is in their blood. It also tells us about their electrolytes in their blood and what their hemoglobin level is. And we can do this just from a tiny spot of blood that we can take from them at the roadside. And again, this is something that can provide us with vital information about the patient's condition and help us decide which hospital is the best place for them to be. So this bit of kit here is actually an ultrasound machine. We carry this and we sometimes use this to look for fluid in the abdomen that shouldn't be there, which might suggest that the patient has got internal bleeding. We can use it to look at the heart to see if the heart's beating normally, and we can also look at the lungs to see if there's been a punctured lung. So this can provide us with vital information about the patient's condition at the roadside, which otherwise they would have to wait until they got to hospital for. And this can help us to make decisions about where the best place for that patient to be is and which hospital they need to go to. So one of the services that EMERTS can provide on the Wales Air Ambulance is the ability to give an anaesthetic to a patient wherever they may need it. Sometimes we do this for patients who have head injuries or brain injuries who need to go to specialist centres, and the safest way of getting them there is to give them an anaesthetic first. Once we've given someone an anaesthetic, then we need to put them on a ventilator, which is a breather machine, which will do the breathing for them. So this is our ventilator. It's a Hamilton T1 ventilator. It's like an intensive care ventilator, and this will do the patient's breathing for them, provide them with oxygen safely to get them to hospital. This ventilator can ventilate anything from a newborn baby all the way up to a fully grown adult. So these are our blood boxes. Essentially this is a really sophisticated cool box, and inside here is 2 units of O negative blood, which can be given to anyone who needs an urgent blood transfusion. So we get blood from the local hospital in Bangor. The blood needs to be kept cool, and this cool box can keep the blood cool at 8 degrees centigrade for up to 4 days, and we get a replenishment of blood every 3 days. If we don't use it, this blood then goes back into the hospital pool where it can be used in the hospital, so the blood's never wasted. And if we do use it, then we get replenishment straight away back from the hospital. And in this pouch here we also have plasma, which contains important clotting factors to help the blood clot as well. So these are our brand new defibrillators. So this is used to provide an electric shock to try and restart someone's heart if they've had a cardiac arrest, and this one also can act as a pacemaker. So we'll just demonstrate, Carl will demonstrate how it gives an electric shock. And again, this is nice and small and light, so it's perfect to fit in the aircraft.
Okay, so this is the Ultrasound Machine, which is basically a mechanical CPR device, which does CPR on the patient and frees up a member of the crew to do other tasks as well to help look after the patient. It works by, we put a black plate under the patient, we put the machine on the top, and we simply place it in place and then start. And the CPR is done entirely by the machine, freeing up the crew member to do other tasks.
So this is our baby pod. So we do sometimes get calls to anything down to a newborn baby or even a premature baby, and this allows us to safely transport small little babies, and the baby can fit inside. It's nice and comfortable in there, nice and soft, keep them wrapped up, and then we can keep them under cover here, so away from all the noise, and it'll keep them nice and warm in there, and we can still keep a close eye on them, we can still see them and access them if we need to through here.